The DNAdose test is a test which for particular drugs to see that they do more good than harm. It came about because there have been tremendous progress in genetics, and it's now possible to do tests to actually see whether the genes that control how drugs are processed in the body are working properly or not. And so what we do is we test to see how fast the drugs are processed in the body. Well, most medications or drugs get changed in the body, and they usually get changed to something that doesn't have any effect and can get passed out in the urine. And there's chemicals in the body that were originally developed to try to get rid of poisons, and they are the ones that break this down. And this is controlled genetically, and people vary tremendously. So some people do it very, very fast, and therefore the drug won't work at the normal dose. And other people do it very, very slowly, and therefore the drug gets too high in the blood level, and that can cause them side effects. So this DNAdose test can try to reduce side effects, and also choose a drug that's likely to work. For mental health patients, although there's been a lot of progress in antidepressant drugs, they don't always work. And they might have to wait 3 weeks before they find out if it's working. This can tell them faster if the drug is likely to work, and also if the drug doesn't seem to agree with them, may explain why that is so, and most importantly, suggest a drug that could be taken instead of this that would be more agreeable for the patient. So we personalise the drug for the patient, and this is part of what is now called personalised medicine. Well, personalised medicine is trying to take account of these individual factors for the individual person and not treating everybody the same. For example, for all drug dosages, people are assumed that they get rid of the drug very quickly, and actually less than 50% do. So what about those other 50%? At the moment, without the test, they're forced to take the same dose as everybody else. With personalised medicine, they can take a dose that's been tailored just for them. There is also a test that tests the most important drugs for pain relief to see if they work or not. And it can also sometimes indicate that they're at risk of side effects. And these particular genetic changes, because the genetic can be inherited, and the changes are very important for children, meaning that children shouldn't have certain pain relievers. And so it's quite an important test to be done in the area of pain relief. I definitely think it's a breakthrough in medicine, and I personally wouldn't take any of these powerful drugs without knowing how my body would react to it. But it is new, and so it is something that's been gradually introduced into medicine.